At some point, this wave of infection will crest, but we don't know what the daily numbers will be at the peak or when this crest will happen.
With so much uncertainty still ahead, Singapore announces a tightening of COVID-19 measures starting on Monday, September 27th. Well, here's one of the changes. Work from home will be the default once again for employees who are able to do so. And a new hospital visiting policy starts today as more infections are detected among staff members, patients and visitors. You're watching The Big Story. I'm Haryanto Diman. Subscribe to the Straits Times channel so you never miss a single episode. A setback in Singapore's bid for COVID-19 resilience. Safe management rules will be tightened from Monday, September 27th until Sunday, October 24th, in a bid to curb the rise of infections which continue to grow exponentially within the community.
We do not expect numbers to come down at all. In fact, they will continue to rise, but hopefully at a slower rate than before, so that we can ride through this wave without overwhelming our healthcare system. After this wave crests, and it certainly will at some point in time, the daily numbers will come down, but they will stabilize at a new level, which is likely to be much higher than what we have been used to before. In other words, we are not going back to a scenario of low daily cases anymore. It's not going to be possible because we are moving forward to learn to live with the virus, and we are continuing with our reopening plans. So that's part of the adjustment that we all have to make to prepare ourselves for the time when COVID becomes an endemic disease and learn to live with more daily cases.
Ministers say the tightening of rules this time around does not equate to a heightened alert, but a so-called stabilization phase. The stricter measures will be reviewed after 2 weeks and possibly adjusted based on the situation then. So, from this coming Monday, permissible group sizes for social gatherings will be reduced to a maximum of 2 people from the current maximum of 5. At the same time, the maximum number of unique visitors per household will be reduced to 2 per day, and individuals should continue to limit their overall number of social gatherings to not more than once a day.
I know that many Singaporeans and businesses will be disappointed by today's announcement. I want to assure you that Singapore remains committed to reopening. We will continue to work with businesses to implement these measures and prepare for reopening. And Singapore will remain connected to the rest of the world. The journey may take longer so that we can do so safely. I seek your patience and support while we adjust our response to ride this wave and future waves of infections.
Now, when it comes to dining in at F&B outlets, the rules are also changing. From Monday, only pairs will be allowed to dine in if both people are fully vaccinated. That's a reduction from the current limit of 5 people for dine-in. Unvaccinated individuals with a valid negative pre-event test result and children aged 12 and below may also be included in such groups. For hawker centres and coffee shops, the limit will remain at up to 2 people regardless of vaccination status. Working from home will be the default for employees who are able to do so, and the 10-day SNAP WFH regime will be suspended during this stabilization phase. Other workplace rules remain the same. Social gatherings will continue to be disallowed. Employees, contractors and vendors who are unable to work from home are strongly encouraged to self-test weekly. And those who are able to work from home but need to return to the workplace for ad hoc reasons may do so after testing negative on an ART. To protect younger kids ineligible to get vaccinated, home-based learning will be extended by 1 day to October 7th, a Thursday. The following day, October 8th, is Children's Day. Private education institutions must also implement HBL for all students 12 and below until October 10th. During this period as well, in-person tuition and enrichment classes for those aged 12 years and below must be held online or be suspended. Preschools will remain open, but parents are encouraged to keep their children at home if they can. Professor Teo Yik Ying is here to weigh in. He's the Dean of NUS's Hock School of Public Health. Welcome to the show, Professor. A reduction of social group sizes, working from home as a default, more measures to protect younger kids. Prof, the task force says the aim of these measures is to slow down the transmission rate. Your thoughts, Professor, given that pulling back on reopening seems contrary to our endemicity stance?
Thank you for having me. So yes, today we heard the need to tighten safe management measures once again, and the measures that will have the biggest impact, I believe, will be the scaling back of dining in, social gatherings, and household visitors from 5 to 2. And I think my colleagues and I, we have always been saying that the journey to endemic COVID is going to be filled with uncertainties, and we shouldn't hesitate to tap the brakes when there's a need. And at this point, I think it's important to start off by emphasizing that given the number of infections that we see daily in Singapore, right now we have about 16,000 cases in the past 1 month. Actually, we continue to learn that the vaccines we use in Singapore are highly effective at preventing severe disease and death. So the tightening of the measures is not a sign that the vaccines are not effective, are not working. But because Singapore has chosen to be extremely prudent in hospitalizing infected cases who are older and who may have underlying medical conditions, despite the fact that many of them actually have no symptoms or have mild symptoms. This is the reason why our hospitals are filling up. So as a country, we are taking steps to move some of these patients to the community treatment facilities, which will continue to provide a high level of clinical monitoring in case the symptoms should worsen. But I think this moving of patients will take time. And equally, the home recovery scheme that we have rolled out, because of the sheer number of infected cases, you could see that we have quite a bit of operational hiccups. So tapping the brakes now will modestly reduce the level of people interacting in public, and actually to provide the time for home recovery operations, for the transfers to community treatment facilities, the transfer to community care facilities to be ramped up. So the key now is to make sure that our hospitals regain the capacity to look after those who truly need to stay in the hospitals. Otherwise, the hospitals are filling up, not because we truly have 1,000 over people who need hospital care, but because of our very cautious protocols that we are putting these people in the hospitals.
To prevent overtaxing of our healthcare capacity, what could be other potential weak links as we ride out this wave?
So you talk about the weak links, and I think it actually depends on how you define the weak links. Because is it defined as settings where we see more clusters happening? Or actually, at this stage, should we be defining weak links as infections happening in settings where there are more unvaccinated people? I actually believe that we should focus on the second definition. How do we ring fence these settings where there are more unvaccinated people or people at higher risk of disease and death, or which will be those who are very frail, immunocompromised, or with serious chronic diseases. So the weak links that I'm thinking about will be hospitals, nursing elder care homes, and even primary schools, because we know our children under 12 are still not vaccinated. And also, let's not forget about those multi-generational household settings where grandparents and grandchildren do stay together. And because right now, I mentioned earlier on, we see very consistent evidence that people who are vaccinated really do have a much lower risk of severe disease, which is exactly what increases the need for hospital care. So we hear the ministers talk about our journey to endemic COVID. It really still comes back to that bottom line of getting as many people, especially those that are vulnerable, to come forward to be vaccinated.
Professor, like you stressed, apart from reducing the risks of severe illness, another benefit to vaccination is a return to normalcy, and some may be disappointed, frustrated, fatigued by today's announcements. What's your message to these people?
Yes, indeed. I think since the start of this year, we have been saying that vaccination will be the key to allow us to return to some degree of normalcy. And yet, despite this, over the past 3 months, we have seen repeated tightening of measures especially given our rising vaccination rate. So I think the journey to endemic COVID is one that many countries in the world is currently still learning as they proceed. There's no textbook answer or 10-year series answers for our policymakers to learn from. And I think more importantly, there will be certain hurdles that must be crossed in order to reach that long-term and sustainable strategy of living with COVID. And I think it's important to highlight here, one of the key strategies is for people to accept the fact that most of us will be exposed and infected with COVID at some point in time, because vaccination and natural infection are exactly what is necessary for us humans to adapt to the coronavirus, just like what we have been doing all this time, adapting to endemic infections. So people have been asking, so what exactly is this endemic COVID game plan, and why do we keep shifting between opening and retightening? I think we are now at from the beginning of the pandemic, we see that when a person is infected, infection actually triggers a natural immune response such that the person is highly unlikely to be infected afterwards for some time. And some countries actually, like Sweden, the UK, tried this approach of natural exposure in the beginning to try and live with COVID before they realized that actually the number of cases with severe disease and death will rise so quickly that it overwhelms the healthcare services. But right now, we actually have highly effective vaccines, which basically reduce infection to one with no symptoms or mild symptoms for the most part of the population. Now, in this situation, if one is infected after having been fully vaccinated, it actually means that there's going to be an additional natural boost to the immune system that helps to ward against subsequent infection. And because the vaccine reduces the risk of disease and death, that is why we say the journey to endemic COVID will happen through vaccination, through natural infection. So we must be mentally prepared to see rising case numbers, especially when most people in the society can be protected against disease and death. But our national strategies and protocols must be ready to handle these rising case numbers and to isolate them appropriately in different settings, whether it's the home, community facilities, or hospitals, so as we minimize the overall harm to individuals and the community. And that means we have to be very prudent in how we decide who are the people who truly need to stay in the hospitals.
Thank you for your perspectives and your time, Professor. That was Professor Teo Yik Ying, Dean of the Swee Hock School of Public Health at NUS. Now you can visit straitstimes.com for more from today's press conference. Now, based on data regarding the need for booster shots, the Expert Committee on COVID-19 Vaccination has further recommended booster shots for people 50 to 59 years old. From October 4th, this group who have received their first 2 doses at least 6 months ago will be invited to receive their booster of the approved mRNA vaccine. An SMS with a personalized booking link will be sent to the registered mobile number for them to book a new appointment. They may get their booster dose at any vaccination center, polyclinic, or participating public health preparedness clinic. The ban on visitors to hospital wards kicks in today, lasting for 4 weeks until October 23rd. Exceptions are made only for visitors of patients who are critically ill and for new mothers on a case-by-case basis. They will have to produce a valid ART or PCR test result obtained within 24 hours of each visit. And the area set aside for this at Singapore General Hospital was busy earlier today, with more than 20 people waiting. Some visitors were shocked and frustrated when they saw the queue outside the centre, but the line moved at a steady pace. Meanwhile, Tan Tock Seng Hospital has extended its emergency department to create more space for staff to screen patients. It said on Sunday that it has been receiving higher than usual COVID-19 positive and suspected cases via ambulances as well as walk-ins. And a video circulating on Facebook this week shows a busy scene at the hospital with patients in half-reclined hospital beds laid out in rows on concrete floor with metal grills. The source of the video is unknown. As at yesterday, there are 1,120 COVID-19 patients in hospital, 37 more than the day before. 163 cases are seriously ill, needing oxygen supplementation, while another 23 are in critical condition in ICU. Of those very ill, 155 are seniors above 60 years old. Last night, the Health Ministry announced large clusters emerging at Maple Bear Preschool in Orchard Road and 2 dormitories. The preschool cluster had 12 cases, including 8 preschoolers and a household member of a case. 6 new cases were added to Bukit Batok Road Plantation Crescent Dorm, bringing its total to 23. And 7 new cases were added to the Tampines Dormitory cluster, which now has 26 cases. With self-testing for COVID-19 becoming the norm, which antigen rapid test kit best suits your needs? Here's my colleague, multimedia journalist Charles Swee, with 5 kits that have been approved for use in Singapore.
With so many kits available, how do we decide which one best suits our needs? Today, we take a look at the kits approved for use in Singapore and compare them based on ease of use. The kits are the Abbott PenBio COVID-19 Antigen Self-Test, Quidel QuickView At-Home OTC COVID-19 Test, SD Biosensor SARS-CoV-2 Antigen Self-Test Nasal Kit, SD Biosensor Standard Q COVID-19 AG Home Test. BD has 2 self-test products on the Health Sciences Authority's approved list, but the company told the Straits Times that both products contain the identical self-test kit, packaged differently for commercial and at-home use. The kit with the retail packaging, the BD Verita At-Home COVID-19 Test Kit, is currently not circulated in Singapore. Today, we will be trying out the BD kit for rapid detection of SARS-CoV-2 given to a student by their school.
And Suen goes on with all 5 swabs. You can watch her informative, comprehensive review at straitstimes.com or on our YouTube channel. On the non-coronavirus front, the driver in 2019's fatal Lucky Plaza crash has been sentenced to 2 years and 6 months jail after pleading guilty to his offences. He's also been disqualified from driving for 10 years. Chong Kim Ho was driving a car near Lucky Plaza when it ploughed into 6 Filipino women, killing 2 of them. The identity of a Singaporean student in a top UK university who'd filmed voyeuristic videos of several women is now known after the Chief Justice today ordered the gag order to be lifted. He is 23-year-old Colin Chua Yi-jin, and today's order comes after 11 of Chua's victims pushed for his name to be revealed. For each charge of insulting a woman's modesty, an offender can be jailed for up to a year and fined. The jobs growth incentive will be extended by another 6 months to March next year to support employers expanding their local workforce. But the extent of support will be reduced in line with improving economic conditions. From October, companies hiring non-mature locals below 40 years old will get 15% wage support of the first $5,000 for up to 6 months. And they will get 50% of the first $6,000 for up to 12 months if they hire mature workers, persons with disabilities or ex-offenders. And before we go, here's something to cheer us up a little. The panda cub at Singapore's River Safari has hit another milestone, opening his eyes for the first time this week. At just 42 days old, he now weighs a grand total of 1.87 kilograms. And that's him cuddling with his mom, Cha-Cha. Aww. For more news and videos, visit straitstimes.com and remember to subscribe to our YouTube channel by hitting the red button below. Once again, I'm Haryanto Diman. Have a good weekend and we'll see you next week.